Hello, PS Platypus watchers. This is a presentation on Otitis, or upper respiratory tract infections. Before we talk about the infections, let's talk about what the upper respiratory tract actually is. Now, we've sort of have an arbitrary barrier between the upper respiratory tract and the lower respiratory tract, with the upper involving the nasal cavity, pharynx, and larynx. There exists a continuum or gradient of pathogens throughout the respiratory tract. So when we talk about an infection being predominantly in the larynx, that pathogen can exist at other sites. So the pathogens themselves don't know that they're in the larynx. It's just that that specific site offers the best environment for it to grow in. An infection occurs when defenses to these pathogens fail. And we have two main types of invaders. We have professional invaders and we have secondary invaders. So professional invaders are pathogens that infect healthy respiratory systems, and secondary invaders infect impaired respiratory systems, impaired in the defense, kind of like in immunocompromised people. Now we've got a big list of conditions to learn. And let's get started with the common cold. This might look like a lot of information, but I assure you that it will make a lot of sense. So thinking about the symptoms, runny nose, sneezing, sore throat, headache, blah, blah, blah. The way that it happens, it's really because of inflammation. So we've got the epithelial destruction and inflammation caused by mediators like bradykinin, leading to swelling and all that good stuff. The organisms, it's mostly due to rhinoviruses and coronaviruses, but can be a bunch of other viruses as well. And that's more or less it. The other key thing is that it has a 2-day incubation period and a short latent period. And we'll talk a bit more about that. So what do I mean by incubation and latent period? The latent period is the period that occurs before the pathogen is infectious. And the overlap between the infectious period and the incubation period is a scary little period in here when they don't have symptoms, but they are infectious. Okay, so next one is pharyngitis or tonsillitis. This is predominantly caused by viral organisms, but the thing that we want to talk about really is group A strep, because that leads to a lot of different complications and it's a pretty good one to know. Symptoms involve swollen tonsils, lymph nodes, pus-filled lesions, so it's suppurative, we call that, which means pus forming, and tender cervical lymphadenopathy. We want to definitely investigate for bacterial causes to make sure we rule out group A strep and provide antibiotics if it is the case. Now, strep throat, group A strep, why am I so scared of this? It's because there's a lot of complications. So we've got this sort of like an overlap of symptoms here. But we've got other stuff as well. Key things is that there's no cough, sudden onset, and there's chills and a high fever. The complications are separated into pus forming and not pus forming. So pus forming includes this stuff and not forming includes this stuff. And I'll go into more detail in each one. We want to do a throat swab, and since it's a gram-negative organism, we can just give penicillin and derivatives of penicillin. Okay, so sinusitis and mastoiditis. Sinusitis refers to an infection within the sinuses, which are air-filled pockets and cavities. So here are your sinuses in your body, which are within the bones of your face. Mastoiditis refers to an infection of the mastoid bone. Again, another bone with literal air-filled pockets, which can get infected. Don't worry too much about the details within them. Just know that these two can go. Otitis media, we'll talk about in a bit, but peritonsillar abscesses. what do I mean by that? So an abscess is a painful collection of pus. And peritonsillar refers to around the tonsils. So it's really exudates that form around the tonsils. And exudate refers to pus. It has another name called, I don't know, Kanzi? Scarlet fever. Scarlet fever is due to the toxin of the strep bacteria, and it causes a red rash all over the body. It has a unique disease progression in the tongue, where it causes a white coating, which peels after a few days, causing a swollen red tongue, known as a strawberry tongue. Note it's non-suppurative, so you don't see any pus. It just refers to the rash and the tongue. Acute glomerulonephritis. So this is a complication due to immune complexes. So that involves bacteria and sort of our immune system working, fighting it, which causes a complex to form, which deposit in the glomeruli of the nephron in the kidney, and that leads to an inflammation. Rheumatic fever. So this is because of, again, our body's immune attack. It creates antibodies against the proteins on the cell wall of the bacteria, but these antibodies actually cross-react with other parts of the body, which means that it actually binds to and attacks other parts of the body rather than just binding to and attacking the bacteria. So an example is rheumatic heart disease, where it can cause damage to heart valves because it binds to that. But yeah. Next condition is going to be diphtheria. Diphtheria, these are the key buzzwords. A foul-smelling false membrane caused by the toxin that sort of blocks the airway, which makes it an emergency, and you want to have a tracheostomy, which is like opening up the trachea, I believe. And you can have enlarged cervical lymph nodes, which leads to a bull neck sort of appearance. Obviously, we have the vaccine for it. It's caused by Corynebacterium diphtheria. Glandular fever. So when I say glandular fever, it goes by another name known as infectious mononucleosis, or you might just know it as mono. And the organism for it is Epstein-Barr virus always. So it leads to swollen tonsils and lymph nodes. And it can actually have a lot of other stuff like an enlarged spleen, liver, fever, loss of appetite, headache, lethargy. And as for the pathophysiology of it, the virus initially replicates within the epithelium and later predominantly within the B cells. And immunodeficiency is a big risk factor for a reactivation. Recovery is generally spontaneous, however, and treatment is more symptomatic. It's difficult to, you don't really see a full recovery sort of thing because of the latency possibility of it. Mononucleosis essentially just refers to the increased monocyte count, so as mononucleosis, which makes sense, kind of like, which you can remember because it does affect the immune system. Acute laryngitis. Okay. So larynx is the part of your your throat, I guess, that allows you to speak and make noises. So it makes sense that an infection to this area acutely will cause a barking cough and general hoarseness in your voice, sore throat, and general cold symptoms. So yeah, just rest up and humidification, I guess. Croup. So croup, when we say that, we really mean Laryngotracheobronchitis. Now, I said that the upper respiratory tract ends at the larynx, I believe. So really, when we go down to the bronchus, this is both an upper respiratory tract and a lower respiratory tract infection. So it does have a lot of symptoms in terms of it can have a barking cough, it can have general restlessness. Restlessness, I say, in particular, because it is age-specific for young infants. And they often are just restless because they can't really tell you what's going on. Possible stridor and respiratory distress. Respiratory distress refers to the inability to breathe, which generally causes distress. And obviously you want to maintain airways for that, which is key. Generally, organisms are viral, but you can have secondary invaders, which is not a professional invader, throwback, callback. But it is generally not the case since it's only viral. Okay, acute epiglottitis. So this is almost always Haemophilus influenzae type B. The epiglottis is useful for us to close the path to our trachea in order for us to swallow stuff, right? So difficulty swallowing makes sense. And I generally think around it, so hoarseness, drooling. And you can sort of imagine or think that if it expands a lot, you're going to be unable to breathe. So respiratory distress is possible. General irritability. One key thing is that you do not want to do a throat swab because throat swabbing that will cause acute laryngospasm, or it may cause acute laryngospasm and respiratory distress. So you want to take a blood culture instead. And yeah, again, mostly in young children and medical emergencies also because of that. So sinusitis, we talked about infection within the air-filled pockets and cavities, but what does that cause in terms of symptoms? We have facial tenderness. So if you touch over these cavities, you have pain. We have discolored discharge because of this fluid accumulation in there. So you sort of tilt your head to one side and you just have stuff coming out of your nose. Tooth pain, nasal congestion, fever, and cough. There's a lot of different organisms that can cause it. They roughly fall into these categories. So you can have community-acquired viral bacterial and hospital-acquired viral bacterial, hospital-acquired bacterial, and mixed. Mixed leads to chronic sinusitis, and all this other good stuff is more acute. And yeah, this is pretty self-explanatory. Otitis Externa and media. Otitis refers to an infection of the ear, and the ear, let's think about the different parts of it. So there's the outer ear, which sort of ends before the entrance of the auditory canal. Middle ear, which goes from the auditory canal all the way down to the eardrum. And the inner ear, which is from the eardrum to all these other structures inside. So the eustachian tube was the tube that connects the inner ear down to the mouth. Down to the front of your face. And you have your other stuff here, like the cochlea, and that's more for your vestibular system for balance. Okay, so otitis externa refers to the outer ear, and it refers to pustules or furuncles, which is essentially raised bumps associated with hair follicles, raised little infections. And the organism we're talking about is Staph aureus. And this is a localized form of otitis externa. We can have a diffuse form of it as well. That is a bit more, I guess, serious. Also called swimmer's ear, leads to a red ear canal and general discharge from your ear. And the organisms involved Pseudomonas aeruginosa, Staph aureus and fungi, and diagnosis and treatment are straightforward. Otitis externa has another one, which is invasive malignant in quotes, because it's not really a cancer, but involves severe spread of infection. That results in severe necrotizing infection, meaning severe, a lot of cells dying kind of infection. and that is almost always Pseudomonas aeruginosa. The treatment involves ear drops, we've got steroids and antibiotics, and also definitely systemic antibiotics as well, because the spread of it means that we probably want to have stuff they're on systemically. People who are at risk include diabetics, immunocompromised, and elderly, and this is a kind of like an emergency. You want to have an urgent referral. Moving into the middle ear, otitis media. So this is predominantly seen in children because the eustachian tube that I talked about earlier that drains secretions to the nasal cavity, I might have said mouth, but this tube is more horizontal. So this increases the infections that occur inside the middle ear since the infections cannot drain away to the nasal cavity. The fluid buildup in the middle ear causes earache, ear discharge, bulging eardrum, blue ear, and possible hearing loss. Fever, lethargy, and irritability are systemic stuff. Irritability also for children. Viruses are most common. So unlike the Otitis Externa, we've got RSV. However, we do see bacteria such as these ones here. The problem with these ones is that acute attacks are generally inadequately treated. And that causes, okay, I think I should rather say that if they are inadequately treated, I don't know about generally, it results in chronic suppurative otitis media. So it chronically discharges fluid through the perforated eardrum, since the eardrum can get damaged, and hearing loss is probably going to happen as well. And I think that is it for my presentation. Thanks for watching. Like and subscribe.